I mean, I think that's the thing. You know, I think when we just choose the things that are correct for the season, it's like crazy, like how much that also like influences sort of the course of pathology. You know, to just I loved it. I this past week I got to see all the patients who I haven't seen in a couple of months because it was solstice, right? So those people who I have just like on the like sort of seasonal grip. So they come in, I'm like, how have you been? And they're like, I've been amazing. And I get them up on the table, and some of them it's a lingering little bit of a lung pulse. Some of them it's a kidney pulse. And it was nothing but either of those two, and it's just like, look at you. This is, like, it's great. It's actually, I think, really cool when it's the solstice, and like somebody who is like young and robust and healthy, I say young, but I've been like in their 30s, and they come up with that kidney pulse, and you're just like, that's good. Like,
yeah,
you know? It's not like when a 90-year-old has a kidney pulse, and I'm like, you gotta make sure your things are together. This is different. It's like, yeah, this is great. You should be this today, you know?
Do you have a lot of people like that you have them set up on a seasonal thing with the solstice, equinox, stuff like that?
I have a few who are set up that way. Maybe like a half a dozen who are like, that's, you know, they're not working on anything, but they know that acupuncture has helped, and so they're like down to go with, you know, that kind of a, which is really cool. You know, one guy who's like, he was an interesting case because he came in with like already a diagnosis from his like TCM doc for like gallbladder fire. And it's interesting. It's like every time he deals with any emotional stress where he should be angry, he doesn't know how to vent his anger, and he ends up with these gallbladder symptoms. They are gallbladder symptoms. But maybe I do a little dispersive work on the gallbladder. Like the gallbladder doesn't really enter into the treatment. It ends up being, I mean, just some whatever pulls.
So what's this show usually?
I treated him for spleen, and I've treated him for lung, and I actually did treat him for kidney the last time I saw him, but again, it was at solstice. He hasn't had a flare-up of his gallbladder symptoms in a while. And, you know, what was interesting is after I tonified the kidney, and I think this is what was really interesting about the last time. Again, it was seasonal. You know, he came in for a seasonal pattern. He got a seasonal treatment. But after the pulse, which was, you know, it was moderate. It felt like a pretty healthy pulse all in all. It wasn't really floating or sinking. It might have been a little on the sinking side if we're, you know, falling off on one kidney, but overall really robust. So I treat it, and then that was when gallbladder was waiting for me. It wasn't waiting for me until after the primary. But I think that's
when it showed up as excess.
That's when it showed up as excess. Yeah, it's like, you know, fill in the deficiency, and then it was like, okay, now that you took care of the pattern, here I am. You can take care of me now.
Sometimes when things like that unexpected show up, like, you know, being that it was a kidney show, like, you know, I wouldn't expect to see gallbladder come up like that, right?
Yeah.
Sometimes I notice, like, the conversations that they're having on the table will cause something like that, you know? Like, because, you know, their mind state is what their show is at this moment. But if their conversation, like, leads them down this chain of thoughts to some other thing that's maybe buried in like a divergent channel or like somewhere deeper that we're not feeling in the pulse, and then that brings that up, and then the pulse will change to like this other thing will show up that wasn't there at the beginning. Because I mean, usually, you know, whatever you see as excess there at the beginning, it's going to be gone by the time you're done with root treatment,
Right.
or mostly, right? But for another new excess to show up, I usually think either I screwed up somewhere along the way in root treatment, or like something about our conversation brought that up. And I've seen cases where like it was like a trigger, you know, I asked a question that I thought was just like a bland question just to like keep them engaged for a moment, and it triggered something that I didn't see was there, and then they're like, oh well, actually this and this and this, and oh, I hate my life, and you know, like all these other things come up.
You know, I think that's interesting. I think that there is an element to that. I mean, I do wonder about whether or not I actually heard Erlen say something similar, that like I have real questions about whether or not anything does get screwed up. So I want to sort of bookmark that. But yeah, the conversations on the table, I feel like it's one has to weigh whether or not those conversations on the table bringing up some excess is therapeutic or is the opposite. So whether or not you're getting, which is I've had an interesting clinical case of exactly that recently, of the question being, how much are you willing to bring up at any given moment? I have a patient with like 30 years worth of PTSD. Well, no. So 30 years since her diagnosis of chronic fatigue that is like secondary to chronic PTSD. So this is around 1993, maybe, that she got this diagnosis. And has been dealing with stuff for 30 years before that, right? So that all led to that diagnosis coming up, and so it was interesting because she came in for just terrible insomnia, right? Maybe one night of sleep every 2 weeks, and to say nothing of herbs, right? Like I decided to, from an acupuncture perspective, work on that upper kidney channel to help bring things up and clear them.
These ones.
Yeah. And I think what I did was I brought things up, but I didn't clear them. But my idea was that, like, okay, it brings things up, then she clears them. She's going to have kind of a rough go of things for a little while, and then, it's going to be cleared out, and she'll be sort of, like, reset. Mm-hmm. And in good faith, I actually continued on that trajectory for literally 2 months. And then finally she was like, I don't think I can, like, handle doing treatment the way we're doing treatment anymore. Mm-hmm. And so instead of doing those, I actually went with no needles, except for maybe, I think, yin tongue and maybe something else. Hot stones on kidney 1 and just tation work all over the body and, like, a lot of, like, skin-to-skin contact. And she, like, slept really well after that treatment and had a few nights of, like, sort of diminishing returns on the sleep, but, like, was getting more sleep. Mm-hmm. And so it was kind of an interesting thing where it was like, okay, like, my idea is let's get rid of the trauma, right? That's my brain interjecting. Mm-hmm. Let's get some trauma up and out and get it processed so that the PTSD isn't a burden anymore. Mm-hmm. And again, I think if somebody wanted to do that work for, say, 8 months straight, I think you could get it all up and you could get it all out. Mm-hmm. But the thing is, it's not like she wasn't getting any sleep off of that treatment, and that's her main complaint, right? So my idea of, like, well, let's process through all of it, and then you're going to get amazing sleep forever. It's like, well, I think from a purely theoretical perspective, I don't think that's a wrong way to look at it.
Yeah. I think it's a difference between Ren Shen Baidu Tong and just Jingfeng Baidu Tong.
Right.
Like,
yeah,
you need to give a little extra oomph first, or maybe just Du Shen Tong, right? Like,
right.
Do they even have the power to process this? And I think, it's good that you have that conversation too, because the conversation sometimes, like, it needs to be their choice. Right. And I don't think I really have that conversation with, like, PTSD type stuff as much as I should, but I definitely have that conversation with, like pain situations sometimes, like where it's like tight muscle issues, like especially like up in here, like the scalenes and the SCM. Mm-hmm. I'll get in there with my finger and, like, pin it and stretch, and I'll be, okay, so we can take care of all of this today, or we can spread it out over 5 treatments. And then they're like, oh yeah, today. And then I grab them and I do this, and they're like, okay, no, let's spread it out. Uh-huh. But also, like, skin issues too. Like, mm-hmm. I'll tell people, like, this is going to get worse before it gets better, mm-hmm. because that's just kind of the process of it. Right. And if we don't go through that process, it's not going to happen. So do you want me to just make you stop itching, or do you want to stop having rashes? I mean, and I feel like that's, like, the crazy thing about, all kinds of healing, right? And yeah, is that, like, I feel like that's the most difficult thing right now, which again, I think some people in our field, especially Japanese acupuncturists, will talk about how, like, healing crisis or a healing experience, what the Japanese call mengen, right, is like means user error. And I don't think it does, right? I don't think it does mean user error. I don't think it does mean operator error. It's like, just like, well, like, it's part of the process, right? It's like, if you want to do deep self-work, it's part of the process. So you want to, like, bury stuff until you're ready, that's fine. You can keep burying stuff, but at some point, you got to dig it all up, and it, I just think that they're, like, 2 different approaches, but I think, you need to utilize, both approaches, right? Like, I've been getting some visceral work done,
And after I get some of the visceral work, I might have an increase in something like anxiety or palpitations or like neck pain or back pain or insomnia, that like comes and goes for a few days. And it is like something saying goodbye in my system. It's something that I've dealt with, at maybe a 1 out of 10, is there at a 5 out of 10 for 3 days. And then it goes away and it doesn't come back. And it's sort of like, it's kind of this amazing thing to watch, but it's like, well, if that's what it takes, like, I'm willing to do the work as the patient, but it's also because I understand that that's sometimes what happens with treatment. So it's like, I think I really want to emphasize that moving forward with folks, that it's just like, it's like experiencing your suffering at a larger depth sometimes is the only way to actually process it out. I mean, with some things, no, right? It's like you like fall and like you have some contusion on your hip after slipping on some ice. Whatever, we can take care of the pain in 1 or 2 treatments from that. No big deal, and it's not going to get worse. It's going to feel less bad and less bad. You know what I mean? Like when it's like that kind of like acute and like short-term injury.
Because it's still in the channels and
Right.
the collaterals, right? It's not in the divergence. It's not like down at the bone level or, buried away somewhere.
Yeah, it's shallow, and I mean that also means that like the psychological aspect of it is really, I mean, at that chi level, right? So they probably like, there is some psychological aspect to it. But it's like a short-term psychological thing. It's not, again, it's not anywhere deeper.
Yeah, that's what I think. Like with my like PTSD folks, it's sometimes it's in there so deep that it's not even really showing up in the pulse. Like it shows up in their shen, but it doesn't even really show up in the pulse.
Right.
Or I'm not perceptive enough to notice the subtlety of it. Like I know it's there because I see it in their actions and their healing process, or their inability to heal from something that is not permanent.
Right.
Unexplainable pain and stuff like that. But I think sometimes those are situations where like it has to be dredged up to the surface by some means other than just the acupuncture, because my skill isn't at that place yet where I can reach it with a needle.
Yeah. I mean, I think at this point, from the grand scheme of things, right? Like I feel like a novice. You know what I mean? Like, and it's crazy to feel like a novice because, we do a fairly nuanced and delicate thing, of which there are very few people who are pure or semi-pure practitioners, right? Like I went to go see somebody who did meridian therapy, and the entire treatment was with cold laser, and it was like the same where I was like, and not on root treatment points, and it was like the same where I was like, well, I came here for Japanese meridian therapy. Like I'm not here to like judge anybody else's treatment, but like I came because I thought you were a meridian therapist. I thought some light needle rotation work based around the root treatment, but then that wasn't the experience. And there's a lot of really cool techniques and cool technologies out there. Anyway, my point is sometimes it feels a little weird to feel like a novice when it's like, oh, I'm a novice, but there's not a lot of other people doing it. So what I was going to say about it, the changing show, or like, change in pulse throughout treatment, things coming up, things changing. Is one of the last workshops I went to, the instructor said that he felt like there was user error if the show went, if you diagnosed liver show and you finished treating liver, it became, just for example, like a kidney show after you treated the liver show, that's an indicator of user error, know. And I've been really trying to process around that, and usually I operate from the perspective that I assume that I'm wrong. If I can accept something at face value that a teacher says, that like I need to shift my frame of reference, but I continue to think about that one, and I still think that especially with a case like that where it goes from liver to now being a kidney. It's like, well, that is, in the Nanjing it says that if it follows either way on the generating cycle, that it's a really positive change. But then the other thing is something's always going to be imbalanced in the body, right? Nobody's ever at perfect homeostasis, so the idea that you should still be liver show at the end of your liver show treatment, to me, it's like I don't 100% buy it. That you should still be the exact same show at the end of treatment. It's like, well, you can change, I think you can,
I haven't noticed that so much. Is what I notice is that my secondary diagnosis will trick me. So the liver show, and I think lung is secondary deficiency. And I'm like, double check, make sure it's not something else, and then I'll treat them, and I'll treat the lung secondary deficiency, and I'll come back and lung will be excess or something like that, And I'm like, oh, so did I over tonify that point? It's just a matter of I just overdid it, or was the wrong diagnosis? It was an excess, but I wasn't feeling it for some reason. That's something that I notice happen. And when that usually happens, it's usually on a patient who, like, every time they come in, it's lung show, right? Every time they come in lung show. And then today, I'm like, that's weird. Today it's liver show. And I'm like, and I'll go double check the notes. Last time, no, it was lung show. And, like, ask them their symptoms and whatever. It seems like lung show, but Pulse says liver show. Treat liver show, and then it's weird.
Oh, interesting. Well, what are you doing on the points? What is your current? Because I think again, this evolves for us. What are you doing at a point right now? Like, walk me through what you do when you're needling.
So right now I'm kind of in a transitory state right now too. So what I've been doing until maybe the last month is similar to what we were taught with the chanting, right? But I never learned the chanting. I'm just not good with that kind of like memorization. And so, but the concept of expanding to the edges of the universe, seeing the patient, returning back to that center point, and then pulling in the elements, the 5 elements, and then channel that to the point. That's what I'm working on. I'm working on that. Like I was doing something similar to that, but I'm trying to do it exactly the way we were taught now, and I'm trying to memorize the vowel sounds, and that's a little, shaking things up a little bit because it takes a lot more concentration than what I was naturally doing. What I feel though, that what I did when I had the best time at a point, and my best experiences with spleen 3 or lung 9 or whatever were not actually where I was trying to do that, which of course I'm still learning, so it's like trying to do it is never going to be the same as just doing it, right? But when I had the best experiences was actually not trying to do all of those pieces, just trying to embody that element. So if there's spleen show, I would just embody earth in my internal alchemy, how I feel, how I see them, how I see the world, how my stance is, my the sturdiness of it, the solidity of it, and just embody earth while I'm tonifying spleen 3, and transfer that feeling through the point. That's where I get like the best pulse change. But I think that is part of the larger system that we were taught. I just lose myself in the process of it, But I think, because every channel there is fire within earth, right? There is wood within earth, there's water within earth. These are all the more subtleties of like the shoe points and things like that, and even the seasons. And so when you do the 5 sounds and you bring in the 5 elements, you're actually, the capacity is there to harmonize, if you're at spleen 3, harmonize earth and fire, earth and wood, earth and water, earth and metal, because you're going through all of them.
Yeah, that's. I think that's a good way to sort of think about the Kodotama. I struggle with it. I don't. I'm not currently using the Kodotama, but I like what you're saying about going through the sort of 5 elements within the element that you're working on. I think that's a meaningful sort of subtlety. The last time I saw Mr. Kuwahara, I actually asked, because as you're very familiar, right? The kodotama is different each time that you see sensei. And I said, like, I just don't feel like I get great results with the mantra. And he's like, it's because it's coming from your brain. And, you know, and I asked about, like, the specificity of it. And it was so funny. He was like, the purpose of the kodotama is so that you don't think. But you're thinking when you do it. So that's the problem. You're not getting good results because you're thinking, but the purpose is to not think, but to be focused on being. And so recently, the last like few months, I actually, rather than using the kodotama, I meditated twice a day, using as a mantra the end of the Heart Sutra, Gate Gate Haragate Harasogate Bodhisattva. And the reason why I chose that one is, you know, I mean, the like purpose of that text is to sort of talk about the idea of achieving, like, you know, enlightenment, achieving sort of satori and transcending samsara, and like sort of seeing the cycle of the universe from the outside, but recognizing your own sort of existence on this plane. And so to me, that sort of as a mantra, I think it gets at some of that same concept, that idea of recognizing the infinite sort of spectrum of time and space, but at the same time being finitely ground here, and sort of like also in that sense recognizing that there is Buddha nature in the patient and in myself, that like that there is a version of us that again exists outside of this time and outside of this space, but is the version of us that we are working towards, where we are the infinite, where we are merged with the cosmos. And so I meditated for 2 months, twice a day, just using Gate Gate Haragate Harasogate Bodhisattva as a mantra. And then I switched to a different mantra during my normal meditation, but use that mantra while tonifying each point. And then I just sit there with that mantra in my head, just being until there is some palpable shift, and then I begin watching breath. So that's my current process.
Watching their breath.
Yeah, watching their breath. So I watch my breath too. I think sometimes an interesting thing will happen with my breath, but I'll just like wait. Actually, I think that'll be the first thing I recognize mostly, is like something happens in me. It might be a change in my breath, or like a change in what's happening with Oshide and Sashide, or like a change in what's happening with my shoulders, or maybe the way that my body feels. But then once I feel some shift like that, then I begin watching the patient's breath to determine when it's time to pull.
Interesting.
So that's my current process. I think it sounds convoluted, but actually it's to me it's way simpler than the...
Yeah, no, it sounds good. I like it. What I watch to know when I'm gonna finish is I feel it in my sashide. I feel like something passed through. What Sensei discusses, like the spark, right, that crystallizes. I feel that in my sashide, and that's when I stop. But what you said about the breath is interesting too, because I have been watching the breath recently. So in my other job, we've been teaching a little section of these courses that we're doing, talking about the brainwaves, different states of brainwaves, and we also have been teaching about parasympathetic nervous system and like down regulation and stuff like that, right? So fight or flight versus rest and digest, right? So first thing I notice when somebody gets on a table, if they come regularly, they're already like Pavlov bell, programmed. When they get on a table, they already start to downregulate.
Right.
So as soon as they're on a table and I hear their belly gurgling, then I know like, okay, it's time to start treating. So usually I try and get them on the table before they start talking, because otherwise like it just mess up the flow, the time, and it gets them into their head too much if they're sitting up and talking. And so I get them on the table before they start talking too much, and then I talk to them while I'm like checking non-pulse type stuff, checking leg length and skin texture or whatever, looking at their face and their complexion. But I don't. I try and get them done talking, or at least I'm not talking anymore when I get to taking the pulse. But usually their belly will start gurgling at some point where I'm just like palpating here and there, and then I know, okay, they're like shifting down from beta waves into alpha waves, right? So you go, the highest ones are gamma waves, which is like bodhisattva level consciousness, right? And then everybody else is operating in beta waves, and then after that is alpha waves, is like your rest and digest mode, right? It's like relax, and then after that theta, which is like dream state, and then delta, which is like deep sleep. And so I get them like when they're shifting into alpha, that's when I'm like, okay, now it's okay to start treating. So belly starts gurgling, I got the pulse, they already stopped talking now, they're in alpha state, and then I start treating them, and I'm watching their breath. When the breath shifts from like waking breath to sleeping breath, I know they've moved into theta state, and then treatment's done. At that point, I stop. Even if I have an agenda of other points that I want to do, I stop when they get to theta state, because they're like just falling into it, and it's easy to like wake them back into alpha by doing something.
Interesting.
So I'm like, try my best, to completely like have everything dealt with that needs to be dealt with by the time they get to that shift in breathing, and then I just leave the room. Because if it's easy to, because they're halfway in and out of that dream state where you spend so much of the treatment a lot of times, right? But an extra question or something, or a point that just is a little too sharp will bring them back into alpha, which is fine, right? But it's not ideal. So I've been watching breath for that reason.
Oh, that's interesting. Yeah, because I mean, since I work the whole time, right? Like, I mean, that's like, I don't ever stop working during the 45 minutes that I'm sort of actively in sort of a treatment mode. But I actually think that, like, again, to sort of think of it that way, I think that like alpha theta bridge is sort of probably where I'm doing most of my work. But like right in those sort of like the borderlands, the liminal state between the two, where they're like sort of dancing in and out, is where, there's an experience that patients will often say when they get up from treatment. I'm sure you've seen this too. They've been snoring for the past 20 minutes, and then they get up and they say, "I almost fell asleep."
Yeah.
They're like, I never snore when I'm awake. So maybe you do.
Yeah. Well, I think they're snoring in theta state, right?
Yeah.
And so they're still like one eye open, watching what's going on, or maybe everything that they think is going on is just a dream.
Right. Well, I think that is, to me, that's like also an exciting place, because it's like, I mean, it's having a trip sitter. I mean, it's the reason why I don't really like receiving traditional Chinese medicine treatments myself, is because I feel like, you can go into those states, but then, I feel like what can happen is, when your unconscious brain sort of takes over and takes those healing messages, again, like I have had some like pretty crazy spectral sort of experiences from traditional Chinese medicine treatments, and it's this uncomfortable thing where it's like, but without a trip sitter, you know what I mean? Like, I want a trip without a trip sitter. As the like first experiments with salvia in high school, I was told, never do this without anyone there. You need someone there. And I feel like that's the thing about, like, I mean, honestly, about acupuncture too. It's like, if you're gonna do that kind of treatment, you better have someone there. If you're gonna like go out into space and deal with your demons and then like crash land into the Atlantic Ocean in your little capsule, you better have the U.S. Navy there to pick you up. So, I
guess it really depends on how much is lurking in the subconscious, right?
Yeah.
That we're opening the door to. And what's on the other side of that door?
Right.
Yeah.
Which, incidentally, I feel like ties into, I've been thinking a lot about Jaki as sort of a concept lately as far as that goes. What the relationship is between experience and the psychological and the physiological, like, what does Jaki mean? I don't know if we talked about this before, but there's a word in Japanese. It's a common word. It's actually Jaki isn't a common word in Japan. But its opposite is, which is mujaki. And mu, as like somebody who has studied Eastern religion, I'm sure you are familiar with mu as like the Japanese term for like nothing or nothingness. So mujaki is just like without jaki, like an innocent original state. If you look up mujaki, two things will come up. One is things that verge on lolly porn, which is very unfortunate. And like the other is just pictures of children, right? And so like mujaki is like it's like a Japanese phrase that means childlike innocence, but the word childlike is missing. It just means without jaki. So jaki are the things that like jade and taint you, right? Mm-hmm. And so it's so funny that it's like we think of jaki as things like exogenous pathogenic influence, which mm-hmm. they are. It's the same term, right? But it's like, well, what is exogenous pathogenic influence? Well, exogenous pathogenic influence can be something you saw on TV. Exogenous pathogenic influence can be somebody said something that you didn't like. Mm-hmm. And it can also be endogenous, right? When like you have a thought that is like negative and it reinforces a pattern that's developed, right? Mm-hmm. And so then it has both a psychological and physiological effect. So I think when we talk about EPI, I think it gets simplified when we think that it's something like being outside on a windy day. It's mm-hmm. But I don't know if this is the case or not, and I hate to sound like Dr. Emoto or something, but like, I wonder if you're outside on a breezy day with the clouds out and, not wearing a scarf, and on one of those days you're with your, best friend who's offering you words of encouragement, and on the other day you're with somebody who you really can't stand, who's like really pressing your buttons in a negative way, right? Which day are you going to get a cold? Uh-huh.
Yeah.
I have to imagine that for any number of like mappable reasons that Western medicine would also probably agree with, it's that day that you're like stressed out dealing with somebody that you don't really care to mm-hmm. be with. It's going to be the day where you're going to catch that cold.
Yeah, that's like I think there's overlap with germ theory there, right? Like if everybody's got strep living in their throat, mm-hmm. why do you get strep throat, right? Like there's the external pathogenic influence, and then there's whatever internal. Right. Because that person you can't stand is because something internal doesn't jive with them, right? Right. And so, like, what is it? What is the real pathogen? Is some internal thing, which was at some point external, right? Right. But it's now like in conflict with the outer environment, not in balance and harmony with the outer environment. This reminds me of something too that I also was kind of like thinking about a lot recently, is going back to the subconscious mind again, right? So 95% of your brain activity is subconscious. Right? So all this stuff that's going on, and a lot of that subconscious is programmed in childhood, right? So if we think back to like Oriental medicine talking about the formation of the channels, right? Like your channels aren't fully formed until you're 8 years old, right? 7 or 8 years old, right? And so in the time prior to that, like looking into like Dr. Manaka's book, right? He's talking about like these are times where it's really more you're depending on the extraordinary vessels, mm-hmm. right? Because the extraordinary vessels are like pre-mammal genetics, or the way we're structured as mammals. This is before we had those 12 channels. Was the extraordinary vessels. We retained that system and added on the 12 channels mm-hmm. after that. So as a child, we're going through this evolution from a cell floating in water to a human, and we're using those. We're depending on those primary or the extraordinary vessels rather than the primary channels. And so, what goes in as a child in those first 7 or 8 years imprints at Jing level, because it's going into the extraordinary vessels. Mm-hmm. It's not going into the regular channels that can push it out and divert it to wherever low channels or whatever they need to do to keep it from going further. but it imprints on your subconscious. So there's like that overlap. You know, Western thought saying, you know, subconscious is getting programmed as a child, you know, and then Eastern thought saying whatever happens as a child imprints on your Jing level. And that, where is that overlap? You know, is that saying then that the subconscious mind is really working more at the level of the extraordinary vessels? And if that's the case, then what are the implications for using extraordinary vessel treatment just for symptomatic treatment? What does that really mean about the symptoms?
Right, yeah. Which, you know, it's like the Japanese are sort of famous for saying, oh, extraordinary vessels are nothing special. Just use them. And again, I wonder if it is the case that it's like, oh, we're doing these like deep treatments when we use EVs the way that we do. It's just we're doing deep treatments that are of symptoms. We're doing like deep symptomatic treatments. But the thing about it is, well, and so that would actually bear out why the clinical results don't last. Because you're not rewriting Jing in one go, right? Like, nobody is coming in for one acupuncture treatment and going out with their Jing entirely reprogrammed forever, right? Like, it's just not how it works, right? Those things take time, they take build-up. But it's interesting, because then again, it's like that idea that, like, yeah, so symptoms are coming from these deep patterns, these unconscious patterns. And you know, I think, for me, that's why, from a linguistic perspective, I like Jackie just fine, but I've been thinking a lot about the way that, like, karma is described by Vedic teaching, where, you know, karma is never a positive thing. There's no such thing. This is when people say good karma. Good karma is a misnomer. There's no such thing as good karma. There's just karma, and it's, I don't even know that it's necessarily bad either, but it's something that's stuck on you that it's your job to clear off, right? It's not, so there's no, like, good karma, because the purpose of karma is that you're supposed to absolve yourself of it. So why would you absolve yourself of, I mean, so there's no such thing as good karma. There's only bad karma, or karma. And so if our, like, job is to, you know, work at absolving that, I feel like it reaches more to the point of what things are than this idea of wicked chi, which I think maps on, again, a little bit more to the idea that just you go outside on a dark and windy day and you catch a cold. It's like, yeah, but, like, that's not, I actually think that Jaki at its root is a thing where it's our life's task to investigate and sort of denature and resolve those deepest issues, right? Which is, like, obviously not every patient is, like, understands themselves to be on this planet to resolve their, like, early childhood and pre-birth issues, right? Like, most people aren't at our clinic to, like, sort of address and, you know, concern themselves with their issues. And yet, I think that is, because we have these mammalian brains, I actually think that is the work that we are on this earth to do, is just resolve those early traumas. Because I wonder, like, if we were all resolved of all of those early traumas that we all necessarily have by virtue of being human beings in a human society, if we were resolved of that, like, what is the potential of humanity? A humanity that has resolved those issues. You know, I think that's how to me, it's like, that's how we get to a point where we solve climate change, and we solve the problem of endless war, and we solve the problem of caring more about big business than humanity. We resolve the problem of caring more about big business than rivers and streams and wildlife. And, you know, I feel like it's like the answer, for me, the answer to that is in unraveling those things that are imprinted on Jing, you know, in the form of Jaki or karma and early childhood, that deep level work. You know, it's like, what if the president was interested in deep self-work, right? What if the president was interested in getting to the root of his own pathology and his own issues with his, like, father and mother and, like, the patrilineage going back 6 generations, and, like, what if that was his main interest in life? Like, yeah, it's like we got to dig ourselves out of that place, you know, that dark place first, to be able to approach doing something productive. Because, like, you know, all of that
it generates fear and like emotions of, lack of self-worth and like the need to, like a dog protecting its bone, you know, like I need to protect this
Right.
little thing that I have, because otherwise you're going to take it from me and I'll have nothing and I'll be worthless. And that's like the motivation behind so many of those issues that you mentioned, you know.
Well, it's the level of the ego, isn't it? Which I think is like the thing that gets imprinted at that early stage of development is like, the ego is, right, like, I need some protection, I need some resources, and the most important thing is that I have something, and so you lose in that, right? Like the real truth of the matter, which is like, I mean, and this is the method by which Hari is supposed to work, right? That all consciousness is one consciousness, right? All consciousness, be it from a plant or whatever the limited consciousness of a mineral is, or in you and I, right? You and I are two facets of the same universal consciousness, and somewhere on that universal consciousness diamond is also Donald Trump. It's hard to imagine, right? But like we're all facets of the exact same consciousness diamond, and if you, on a deeper than intellectual level, which I don't know if I've ever like truly gotten there yet, on a deeper than intellectual level, understand that it is all legitimately one consciousness. That like the underlying sort of mycelial fabric that runs through all of those things is to sort of, let us all know that like we're, it is, all one, right? Like it says on the Dr. Bronner's label,
Dr. Bronner's.
So
Yes.
we're all like literally all one, right? It's like it's a nice Dr. Bronner / Rasta sort of mantra, but it's also like real. Like it's like, we're all one. And I think that, I think even to just do enough self-work to understand it intellectually, I think is like on one level, but I think the other thing is that like if you've done enough self-work to realize that like it's not on an intellectual level, it's on this like deep, real level that we're all sort of one consciousness. I think if you can have that realization, then there's no insurmountable problem.